discussing one of the most important topic of the lower limb, that is popliteal fossa. It is mainly important for theory and also for the viva practicals. Mainly in the viva, most of the questions are asked here, and the viva cadaver is shown, and the teacher asks you about the boundaries in the muscles and all, and the content about popliteal fossa. That's why it's a very important topic of the lower limb. So let's start the popliteal fossa. Starting with the boundaries of the popliteal fossa. Firstly, we are here seen this popliteal fossa is diamond shape here, and its superior lateral boundary of the popliteal fossa is formed by biceps femoris. That is, this muscle that is highlighting here is a long head of bicep femoris. Long head of bicep femoris forms the superior lateral boundary of the popliteal fossa. Here, this muscle that is highlighting here, this is semi-membranous muscle. Semi-membranous muscle, this is highlighting here, it forms the superior medial boundary that is present on the medial side and on the superior. So this forms the superior medial boundary of the popliteal fossa, and this muscle that is highlighting here, you can see here, this is here is a very thin tendon like, so it's called as semi-tendinous muscle. In the cadaver, you identify this muscle as a, its tendon is a very long and narrow and is white in color, so you can identify it as a like this. And semi-membranous is like a membrane like, so there is a most of confusion here in these muscles, semi-tendinous and semi-membranous, when we are seeing in viva and cadaver. So you can identify as semi-tendinous is very thin tendon, is having a long tendon that is very thin and is a very cord like, that is white in color. You can identify like this. Okay, this is semi-tendinous, this is semi-membranous. These two forms the superior medial boundary. And one of the muscle, that is gracialis, and here which are seen here is gracialis also. This also as a supplemented muscle here for this form the superior medial boundary. It mainly not form the superior medial boundary, but is supplemented muscle. It supports these muscle also. Okay, now we see here this muscle. This muscle here, this muscle here is a gastrocnemius muscle. Here this is the one side, lateral side, here is the lateral head of gastrocnemius muscle, and on the medial side, medial head of gastrocnemius muscle. So superior lateral boundary is formed by the lateral head of gastrocnemius muscle, and inferior medial boundary is formed by the medial head of the gastrocnemius muscle. Okay, this whole muscle is a gastrocnemius muscle, and the head present in its left side is a left head, that is this head is left, and present on the right side, that is medial side, that is the medial head of the gastrocnemius. This the muscle form the inferior lateral and medial boundary by their respectively lateral and medial heads. Okay, this all about the boundaries of the popliteal fossa. Boundaries of the popliteal fossa. Okay, now one of the main thing, that is roof of the popliteal fossa. Here we are fading this muscle. Now this vein here, this vein that is short saphenous vein, we call it as a small saphenous vein, that is present in the roof of the popliteal fossa. And roof is mainly formed by the deep fascia and the skin, and the superficial fascia and skin, deep fascia, and the deep superficial fascia, small saphenous vein is present. These forms mainly in the roof of the popliteal fossa, and one of the vein is here corresponding to the small saphenous vein. Here is an nerve that is highlighting here, that is blue in color, highlighting here near small saphenous vein, that is the sural vein. Sural vein is mainly the superficial uh, superficial part, or we can superficial part of the tibial nerve, that is here. It arises from the tibial nerve. This is the tibial nerve here, and is a superficial part of the tibial nerve, that is arise from the tibial nerve. So this is the sural nerve. It's also present in the roof of the popliteal fossa, that is highlighting here now. Okay, now roof here. Now we are coming in the contents of the popliteal fossa. Here contents are mainly most important is here content. We have to learn the relations of the content, that is which is present in the most medial side and which is present most lateral side, corresponding in the upper part and in the lower part. This is important and it is asked in the viva and the theory, and anywhere you have the popliteal fossa coming in the question as a question. This is very important question. This is a content that which is present most medially, which is present most laterally. So we are hiding with this muscle, that is semitendinous, and below this is semimembranous. Okay, now hiding this muscle. This muscle here is, that is highlighting here, this is adductor magnus, is also supplemented as a superior medially, that is supplemented the superior medial boundary also, that is gracialis is also supplemented here, adductor magnus also supplemented here. These are not exact the muscle of the boundaries of superior medial side. Now here we are hiding also this muscle also. Now we see that in superior part we are able to distinguish that in the superior part this is the artery, as this is in, highlighting here, this is the artery, that is a popliteal artery. Popliteal artery here is important thing is that the in the upper part of the popliteal fossa, popliteal artery is present most the medial structure. This is very important. Here you can identify this is the most medial structure, and after that here is a vein, that is popliteal vein. This is lateral to the artery, and after that we are now hiding this muscle also, that is biceps femoris. You can distinguish here that this is sciatic nerve here, which is highlighting here sciatic nerve, and sciatic nerve gives its parts, that is tibial nerve, and here this is common peroneal nerve. This is common peroneal nerve, and this is tibial nerve. Here after vein, the most after vein, the lateral, on the lateral side present here is a um, tibial nerve, and after tibial nerve here is a, that is highlighting here now, that is common peroneal nerve, that is present most lateral side. Now coming to the inferior part here, we are hiding this gastrocnemius muscle here, and see the relations here. Here you can identify that in the middle part here, in the popliteal, that is the popliteal part of the femur bone, that is this is the femur bone mostly, this is the femur bone, and here where is present these arteries in the inferior part, here these are popliteal part of the femur bone, and in below this, that is middle intermiddle condylar space, that is between the condylar, here these you can able to distinguish that this is artery nerve, and below this is artery, and below this is nerve vein. So these are all superficial to each other, or we can say that the artery is most of the deepest structure here. You can distinguish that this is the artery. These are present in actually is one line here in the medial part of the popliteal fossa. These are present mainly in the one line, or we can say one above each other. So you can distinguish here this is artery to present most deep structure. After that vein is present, which is superficial to the artery, and after that we have the tibial nerve, which is superficial to the all these structure. Okay, and you can here in the lower part you can distinguish here that tibial nerve here, this is tibial nerve here, and the lateral, or we can say that in the inferior part tibial nerve, that is here highlighting here, tibial nerve is most medial structure. After that tibial nerve you can distinguish here this is venous. After that we have vein, and after that we have in the late inferior part we have artery, which is present most laterally. So this is the one of the main relation here you can distinguish here most clearly in the cadaver, that in the superior part we have artery is the most medial, after artery we have vein, after that we have tibial nerve, and after tibial nerve we have peroneal nerve, or you can say that is a common peroneal nerve. These two nerves are the branches of sciatic nerve. And in the middle part here, these three are present in a line or over one each other, and the artery is the most deepest, then we have vein, then we have nerve. And in the inferior part, this you can distinguish here, the nerve, that is tibial nerve here. This is the most medial structure. After that we have vein, you can distinguish in the uh, inferior part here. This is highlighting as a blue. This is after that we have vein, and most laterally we have the uh, popliteal artery. Okay, these are the main contents of these popliteal fossa. As I think that all these content are clear now. Okay, now one of the main thing here is that we can distinguish here the branches of the popliteal artery here also. That is, this is the popliteal artery here. This branch, this branch is the lateral superior genicular nerve, that is present on the superior side and on the lateral side. So here these are the superior lateral genicular nerve. Okay, now on the medial side, here highlighting this. Now this branch of the artery is medial superior genicular branch. That is, these are the genicular branch of the popliteal artery, and this is present on the medial side, that is medial, and on the superior side, that is, so we can say that medial superior genicular branch, and on the lateral side we have this, that is highlighting here. Okay, now this is the present on the lateral side, so this is the lateral superior genicular branch. Okay, now coming on the inferior side, we have this branch here. Actually this is highlighting, actually I am zooming this branch. This is the popliteal artery, and this branch of the artery, now this is highlighting, that is, this branch of artery is inferior medial genicular branch. That is inferior medial genicular branch, that is present on the inferior side and on the medial side. So this is the inferior medial genicular branch of the popliteal artery, and on this side, this is highlighting this artery, this branch of popliteal artery. So this, actually by the logic, this become the inferior lateral genicular branch of the popliteal artery. Okay, here we can say that, we can see that this is the peroneal nerve, common peroneal nerve here. Okay, now I am highlighting this actually this muscle, that is this muscle. I am highlighting this muscle, that is plantaris muscle. Plantaris muscle, actually this is present as the floor mainly. We cannot say that as a floor, but this is below these, but not counted as a floor of the popliteal fossa. We are not counting the plantaris as a floor. Now this muscle, I am like right now highlighting this muscle. This is the popliteus muscle. This is the this form the floor of the popliteal fossa, which of the main muscle of this hair, that is, this is popliteus muscle, that is the main muscle here. And this form, now this muscle, this is highlighting here, this is the popliteus muscle, which form the content of the floor of the popliteal fossa. And the popliteal fascia, strong popliteal fascia also form the uh, along with the popliteus muscle also form the floor. And along with these, this is the, these are also, this is not the capsule actually, the capsule of, mainly the capsule of the knee joint mainly also form the floor of the popliteal fossa. Okay guys, these are the content and boundaries of the popliteal fossa. I think you all now aware with the boundaries and the content of the popliteal fossa. This is the main question actually that comes in the viva. You, teacher asks you, show the popliteal boundaries of the popliteal fossa, arteries, vein, and their relations in the cadaver, and also come in the 10 marks question as in the university exam. So thank you guys very much.